I'm the head of VIRL at UNSW. This is actually a very large group of academics who do research, teaching and advocacy in immunisation, mainly in high-risk groups, particularly adults and the elderly, but many other risk groups including travellers, migrants, refugees, healthcare workers, immunosuppressed people and Aboriginal and Torres Strait Islander groups. The role of UNSW VIRL is to do research into difficult and challenging questions around high risk and adult vaccination.
My role at UNSW VIRL is as a senior epidemiologist and applied biostatistician. Vaccination is the best way for preventing infectious diseases.
It's estimated that about 3.8 million Australian adults who are eligible for vaccination are unvaccinated.
So we have a number of vaccines that are free for older people: influenza vaccination, zoster vaccination and pneumococcal vaccination.
The Australian adult population is a huge population and there's millions of people at risk.
Vaccination is one of the most effective ways to prevent infectious diseases in both children and in adults.
Traditionally we've always thought about vaccines being something in childhood, but actually nowadays we've done a great job in controlling infection in childhood, but there's heaps of disease in adults, things like pneumonia, influenza, shingles are all. And now we actually have tools to prevent this.
Adult vaccines are particularly important because older adults are at higher risk of infectious diseases, including those that can be prevented by vaccines.
We're interested in issues like why is there a gap in vaccination rates for free vaccines between adults and children.
Older Australians are at much higher risk of vaccine preventable diseases. They have a much higher incidence of disease, and when they get the infection, it's often much more severe.
From our models and from data, we know that as you get older, your immune system doesn't behave properly. You acquire diseases or exposures throughout those 50, 70 years of life that put you at more risk.
The significance of UNSW VIRL is that it's a research hub for research in at-risk groups, particularly adults.
UNSW VIRL is an excellent opportunity to bring together researchers who have a range of experiences, from myself like social research to those who are doing mathematical modelling, health economics, people who do work with large data sets or epidemiologists, bringing together a range of skills to work on the issue of immunisation.
We want to increase the amount of research and teaching and advocacy around adult immunisation to help Australians live longer, healthier lives.
UNSW VIRL is really the first time that there's been a centre of experts who are really focused on high-risk groups in the population and adults, including the elderly, for immunisation.